Policy development. Inform, educate, and empower people with health issues. Mobilize community partnerships and action to identify and solve health problems. Develop policies and plans that support individual and community health efforts. In addressing the epidemic of childhood obesity, it is imperative to inform the public regarding the scope of the problem, educate parents, teachers, and students on the benefits of proper nutrition and adequate daily exercise, and to empower children to make better choices, thus ensuring better health outcomes in the future. There are many organizations that play an active role in the national level and state level that are combating obesity. Some of these organizations, such as the CDC, NANA, or Shape Up America, have been around for quite some time, while others like InPlay Foundation have just begun the war on obesity. Shape Up America is a nonprofit organization that wants to educate and bring obesity awareness to the nation. This organization expresses that diet and exercise can help maintain healthy weight. They've been keeping people aware of health issues since 1994. The National Alliance for Nutrition and Activity is an organization that brings awareness about obesity on a national level. For 40 years, the NANA has been advocating healthy living for all people. Its programs and policies have been geared to promote more healthy lifestyle activities. The InPlay Foundation is a nonprofit organization that enlists the help of professional athletes, both retired and active, to combat childhood obesity. Their mission is making healthy kids that are ready to learn, is echoed throughout the nation through television and sports venues. The CDC is a federal government agency that looks into various issues that plague this nation. One of these issues is the obesity epidemic of our nation. This agency provides many facts and programs that are vital to parents and children. The information is distributed by the CDC Nutrition, Physical Activity, and Obesity Division. The New York stakeholders include the New York State Department of Health, the New York City Department of Health and Mental Hygiene, the Citizens Committee for Children of New York, Live Right, Live Light, and the New York Coalition for Healthy School Food. The personal stakeholders include the Governor of New York, Andrew Cuomo, the Deputy Mayor of Health and Human Services, Linda Gibbs, and the Obesity Program Manager, Kyle A. Restina. Current school nutritional policies in the state of New York require that those school districts participating in the National School Lunch Program adopt and implement wellness policies that are designed to promote well-being and reduce obesity. Implementations of these wellness policies are federally reimbursed, and they are to include nutritional guidance for all the foods served or offered on a school's campus. The wellness policies, however, do not address what is known as competitive foods, those that are offered in a vending machine or other areas on campus that are not federally reimbursed under the NSLP. Competitive foods include high sugar, high fat, and starchy foods and beverages, including cakes, sodas, cookies, gum, etc. Although competitive foods are suggested to be restricted and monitored in compliance with wellness policies, school nutritional committees are permitted flexibility surrounding these foods and their accessibility. The Institute of Medicine has set standard guidelines applicable for foods in schools. However, these guidelines are not required to include competitive foods that can be found in vending machines, student stores, or other areas in which these items are sold or provided by vendors. They are otherwise treated as suggestions for schools implementing wellness policies if they wish to expand policies further to include competitive foods. The Healthy Schools Act of New York targets children in predominantly lower-income communities by working in collaboration with local school districts in which 50% or more of the students are participating in the free or reduced lunch program. The Obesity Prevention Program and its partners in the New York State Department of Health include Healthy Heart, Diabetes Prevention, and the Alliance of Healthier Communities, is providing state funding to improve physical activities in schools. The plan is to add more moderate to vigorous intensity physical activities throughout the school system, increase the availability of physical activities, and write policies that encourage an increase in physical activities. An audit completed and reported by the Office of the Comptroller in New York reports that only 4 of the 20 school districts reviewed complied voluntarily with suggested guidelines surrounding competitive foods. All districts, however, complied completely surrounding the requirements of the participation in the National School Lunch Program. This is a clear indication that inconsistencies that need to be addressed and clear standards set regarding competitive foods. Policy enhancement should remove the ability to be flexible in addressing vendor items being sold at schools. The IOM's guidelines should also be followed as a requirement under the NSLP, and incentives given to the districts who implement more restrictions on competitive foods. Currently, education law suggests that those districts implementing wellness policies also form a nutritional advisory committee. This should not be a suggestion, but a requirement for all districts. New York City has specific guidelines set for the amount of time each student has physical education. Although the time increases in upper grades, the most required is 180 minutes a week or 36 minutes a day. All students must participate in physical education each semester they attend school, and there are no waivers or exemptions, and if a student has a medical condition, a physician's certificate of limitation is required indicating what activities a student can participate in. Looking at the changing health-related landscape in New York. Parents setting the example. Parents can improve their children's eating habits even if their own were less than stellar. Sugary drinks. The average American drinks 52.4 gallons of carbonated soft drinks a year. Promotion of the consumption of tap water or bottled water is necessary. Fast food. Many fast food establishment menus with more foods to appeal to health-conscious diners, such as apple slices, egg whites for breakfast, and whole grain bread. Government benefits. Changes in the federal WIC program, which provides food vouchers for the poor, may also be encouraging healthier eating, eliminating juice from infant food packages, providing less saturated fat, and making it easier to buy fruits and vegetables. And access to fresh food. A number of programs are giving people in poor neighborhoods more access to fresh and affordable fruits and vegetables. In December 2011, New York, the state established an obesity task force to prevent and control obesity. The task force identified 4 key goals to guide its work: reduce obesity, address disparities between communities, reduce preventable health conditions, create strategies to lower healthcare spending and lost productivity. Their findings: obesity is one of the most serious and rapidly growing health problems. Obesity has a disproportionate impact on low-income and minority communities, and obesity is expensive. And obesity is an environmental disease. The New York State Obesity Task Force. To prevent obesity in children, we need to promote and expand the Department of Education's nutrition and wellness efforts, encourage healthy eating, through the promotion of healthy eating includes decreasing the consumption of food and beverages that are high in calories and nutrient poor. Promote physical activity and lead by example. The New York State Department of Health has established partnerships in combating the childhood obesity epidemic. The United Way of Schenectady. This program serves 2 primary purposes: positive youth development and community collaboration in an organized fashion. The Center for Obesity Research and Education is to serve as a research and educational resource for endeavors on obesity and physical activity to reduce the burden of obesity in children. The schools and professionals in nutrition pair school professionals with a volunteer nutritional professional who work together to improve nutrition among students. The Obesity Prevention Program has a web-based resource that they can use to promote physical activity and healthy eating. Assurance and research. Enforce laws and regulations that protect health and ensure safety. Link people to needed personal health services and assure the provision of health care when otherwise unavailable. Assure competent public and personal health workforce. Evaluate effectiveness, accessibility, and quality of personnel and population-based health services. The goal of wellness policies are to provide students with the necessary skills to establish and maintain overall healthy well-being through nutrition and physical activity. The State Board of Education is responsible for monitoring and enforcing wellness policies as outlined in the Reauthorization Act of 2004. Although many schools may create a wellness policy of compliance with little follow-through, it is parents who must file complaints if their schools are not complying. NPLAN is a nonprofit organization dedicated to preventing childhood obesity. They provide legal information related to public health and are equipped to help parents get their schools to comply. A number of state and federal programs exist to ensure that children receive free or reduced cost nutrition that otherwise may be unavailable. Some of these programs, like WIC, TFAP, and SNAP, are funded by the federal government and provide supplemental foods, healthcare referrals, and education assistance to eligible low-income individuals and families. The USDA Commodity Food Program and state-based child nutrition programs directly support the NSLP by enabling schools to order wholesome and nutritious foods for their students through their program. Assuring the public that a competent and qualified workforce is providing nutritious and safe food to children of a community is a task of the school district directors and nutrition managers. They are responsible for following federal, state, and local regulations, which include the inspection and safety of the foods they prepare, as well as meeting the nutritional requirements. It is important not only to provide children with proper food, but to encourage their consumption by having other school staff model the proper behavior of a healthy lifestyle. This means eating the same meals and snacks provided to students, as well as actively participating in physical activities. New York has seen a significant drop in its population against obesity. Bucking national trends, rates of obesity for New York City kindergartners through 8th graders decreased 5.5% from 2006 to 2011, with the sharpest declines, 10%, seen among children 5 to 6 years old. Nonprofit organizations and healthcare facilities both have contributed in the efforts to give children and adults longer lifespans through education and lifestyle changes. Access to these programs is geared to every population base within New York. There are but a few programs or research by various healthcare facilities or joint ventures by nonprofit organizations and school systems to battle against obesity. Each one is unique in its own way in how it combats obesity. The Obama administration has been instrumental in combating obesity in American schools. In 2012, big changes were made to the government-subsidized school meals. New rules were put in place that would increase fruits and green vegetables in schools and reduce amounts of salt and trans fat. The U.S. Department of Agriculture has updated the nutritional standards for schools with the most recent dietary guidelines. While this was a small step in the right direction, this nation is still woefully in need of radical changes. This is the same administration that allowed ketchup to count as a vegetable. In order to reduce the incidence of childhood obesity, bigger changes are necessary within the school lunch and exercise programs. By swapping out unhealthy food items with more nutritious fruits, vegetables, whole grains, low-fat meats, and reduced-fat milk, children receive the necessary foundation to make better food choices in adolescence and into adulthood, thus reducing the chance of adverse health consequences. In conjunction with healthy menus, schools need to reassess mandatory physical education amounts and consider an increase to include some type of physical activity every day for at least 30 minutes to better align the program with the standard exercise recommendation. With these changes, the incidence of childhood obesity will decline, thus ensuring the better long-term health outcomes.